ACTH stimulation test, Wikipedia article audio. The ACTH test is a medical test usually ordered and interpreted by endocrinologists to assess the functioning of the adrenal gland's stress response by measuring the adrenal response to adrenocorticotropic hormone or another corticotropic agent such as tetracoxib or ACTH. ACTH is a hormone produced in the anterior pituitary gland that stimulates the adrenal glands to release cortisol, dehydroepiandrosterone, dehydroepiandrosterone sulfate, and aldosterone. During the test, a small amount of synthetic ACTH is injected, and the amount of cortisol that the adrenals produce in response is measured. This test may cause mild side effects in some individuals. Versions of the test. Preparation. This test is used to diagnose or exclude primary and secondary adrenal insufficiency, Addison's disease, and related conditions. In addition to quantifying adrenal insufficiency, the test can distinguish whether the cause is adrenal or pituitary. The insulin tolerance test is recognized as the gold standard assay of adrenal insufficiency, but due to the cumbersome requirement for a 2-hour test and the risks of seizures or myocardial infarction, the ACTH stimulation test is commonly used as an easier, safer, though not as accurate, alternative. The test is extremely sensitive to primary adrenal insufficiency, but less so to secondary adrenal insufficiency, while secondary adrenal insufficiency may thus be dismissed by some interpreters on the basis of the test. Additional testing may be called for if probability of secondary adrenal insufficiency is particularly high. Adrenal insufficiency is a potentially life-threatening condition. Treatment should be initiated as soon as the diagnosis is confirmed, or sooner if the patient presents an apparent adrenal crisis. This test can be given as a low-dose short test, a conventional dose short test, or as a prolonged stimulation test. In the low-dose short test, 1 g of an ACTH drug is injected into the patient. In the conventional dose short test, 250 g of drug are injected. Both of these short tests last for about an hour and provide the same information. Studies have shown the cortisol response of the adrenals is the same for the low-dose and conventional dose tests. The prolonged stimulation test, which is also called a long conventional dose test, can last up to 48 hours. This form of the test can differentiate between primary, secondary, and tertiary adrenal insufficiency. This form of the test is rarely performed because earlier testing of cortisol and ACTH levels in association with the short test may provide all the necessary information. Administration. The test should not be given if on glucocorticoids or adrenal extract supplement, as these will affect test results. Stress and recently administered radioisotope scans can artificially increase levels and may invalidate test results. Spironolactone, contraceptives, licorice, estrogen, androgen, and progesterone therapy may also affect both aldosterone and cortisol stimulation test results. To stimulate aldosterone, consumption of salt should be reduced to a minimum and foods high in sodium avoided for 24 hours prior to testing. Women should ideally undergo testing during the first week of their menstrual cycle as aldosterone may be falsely elevated in the luteal cycle secondary to progesterone inhibition, leading to a compensatory rise in aldosterone levels. Traditionally, cortisol and ACTH levels are drawn at baseline. Next, synthetic ACTH or another corticotropic agent is injected IM or 4, depending on the agent. Approximately 20 ml of heparinized venous blood is collected at 30 and 60 minutes after the synthetic ACTH injection to measure cortisol levels. Potential side effects. ACTH samples are kept on ice and sent immediately to the laboratory, whereas cortisol does not need to be kept on ice. Commonly reported reactions are nausea, anxious sweating, dizziness, itchy skin, redness and/or swelling of injection site, palpitations, and facial flushing, but should disappear within a few hours. Rarely seen, but serious side effects include rash, fainting, headache, blurred vision, severe swelling, severe dizziness, trouble breathing, irregular heartbeat. In healthy individuals, the cortisol level should double from a baseline of 20 to 30 g/dl within 60 minutes. For example, if the serum cortisol level was 25 g/dl before the stimulation, it should reach at least 50 g/dl. Interpretation of results. In Addison's disease, baseline cortisol is well below 10 g/dl and rises no more than 25%. Cortisol stimulation. ACTH may dramatically stimulate cortisol from the low baseline value encountered in patients suffering from secondary adrenal insufficiency. Stimulation resulting in a greater than 14-fold increase in serum concentration over 30 minutes has been reported, although more typically serum cortisol levels will double or triple from baseline. The lower the baseline cortisol, the more likely it is that the patient's cortisol will increase by a large amount. ACTH plasma test plus cortisol stimulation. In some instances, a second test can suggest primary adrenal insufficiency. The diagnosis may be changed from secondary to primary adrenal insufficiency or to include primary adrenal insufficiency. In secondary adrenal insufficiency, if the adrenal glands lack ACTH for enough time, cortisol production can atrophy and fail to rise to a value at least double the base cortisol value. It is proper to continue with the diagnosis of secondary adrenal insufficiency. If secondary adrenal insufficiency is diagnosed, the insulin tolerance test or the CRH stimulation test can be used to distinguish between a hypothalamic and pituitary cause, but is rarely used in clinical practice. Aldosterone stimulation. An ACTH plasma test should always be given at the same time as the ACTH stimulation, although many doctors consider the test inaccurate. This test measures how much ACTH the pituitary gland is producing. A healthy ACTH value should be just into the upper third of the range. The ACTH plasma and ACTH stimulation test together can give a clearer picture, especially for secondary adrenal insufficiency. ACTH will be high, either at the top or above range. In Addison's disease, ACTH may be way above range and may reach the hundreds. In very rare cases can reach the 10 hundreds and 20 hundreds. ACTH will be low, usually below 35, but most people with secondary fall within the range limit. Although uncommon, values for ACTH can reach into the low 40s. In some cases, actual cause of low ACTH is from low CRH in the hypothalamus. It is possible to have separate ACTH and CRH impairments such as can happen in a head injury. The ACTH stimulation test is occasionally used to test adrenal production of aldosterone at the same time as cortisol to also help in determining if primary or secondary hypoaldosteronism is present. Human ACTH has a slight stimulatory effect on aldosterone, but the amount of synthetic ACTH given in the stimulation is equivalent to more than a whole day's production of natural ACTH, so the aldosterone response can be easily measured in blood serum. Same as cortisol, aldosterone should double from a respectable base value in a healthy individual. Other hormones and chemicals that will rise in the ACTH stimulation test. The aldosterone response in the ACTH stimulation test is blunted or absent in patients with primary adrenal insufficiency including Addison's disease. The base value is usually in the mid-teens or less and rise to less than double the base value, thus indicating primary hypoaldosteronism and is an indicator of primary adrenal insufficiency or Addison's disease. Simple diagnostic chart. Aldosterone response of several factors from a low base value. This factoring indicates secondary hypoaldosteronism. Usually doubling to quadrupling from a low base aldosterone value is what is seen in secondary adrenal insufficiency. Decoupling of aldosterone in the ACTH stimulation test is possible. A result of doubling or more of aldosterone may help in tandem with a cortisol stimulation that doubled or more confirm a diagnosis of secondary adrenal insufficiency. In rare cases, an aldosterone stimulation which did not double, but with the presence of low potassium, low renin, and low ACTH indicates atrophy of aldosterone production from the prolonged lack of renin. Similar to the cortisol stimulation in ACTH deficiency, the test interpreter may lack knowledge of how to properly interpret for secondary hypoaldosteronism and think a result of aldosterone doubling or more from a low base value is good. The test is also used to diagnose hypoadrenocorticism in dogs and sometimes cats. Veterinary medicine.